Good morning, and thank you for joining us at the second annual Chancellor's Leadership Series. I'd like to thank TELUS for sponsoring the series and enabling both today's conversation and the Leadership Scholarship to be announced later this year. I launched the Leadership Series to acknowledge the importance of leadership to the future of Canada. My hope is that the dialogues like today will inspire young Canadians to reach their potential through enabling access to leaders who are having an impact on Canada and supporting the 4 pillars that we outlined in our series. Very essential for a prosperous Canada: innovation, diversity, entrepreneurship, and sustainability. I'm very grateful to TELUS for supporting this vision. Today's event will include a question and answer period, which will be a mix of pre-submitted and live questions. The live Q&A feature will be turned on following our guests' introductions. We will also have a draw for 3 gift cards courtesy of the University of Windsor Alumni Association at the end of today's event, and we will contact the winners directly. Today, I am so pleased to introduce to you 2 inspiring Canadian leaders, 2 women whose skills, style, and passion have had remarkable impact on those they have led and on the health and well-being of Canadians. Their bios have been posted, so please take the time to read them. A great deal has changed since we launched the Leadership Series a year ago. The pandemic has challenged us at every level of our lives and has tested our resilience, our humanity, our relationships, and our health. When reading about crises, we often read about those resilient people, organizations, or companies that have come out at the other end of the crisis stronger. Resilience is facing life's pressures in a way that promotes growth. Yet in these times, with the pressures of COVID-19, racial injustice, environmental disasters, and the exponential changes introduced by technology, resilience has become a focal point of many discussions. So our topic today, resilience in time of change and uncertainty. Our celebrated leaders have had a lasting impression and impact on mental health and resilience. Dr. Catherine Zahn and Kathy Hay, who will each take 10 minutes to speak to you about resilience, leadership, and mental health through their unique lenses. Kathy Hay as President and CEO of Kids Health Phone, and a fervent believer in the power of community. And Dr. Catherine Zahn, President and CEO of the Center for Addiction and Mental Health, a neurologist and champion of the integration of psychiatry and neuroscience, promoting equitable healthcare to people with mental illness. Welcome to both of you today.
Thank you, Mary Jo.
Dr. Zahn, can you briefly share your background with the audience and tell us how the pandemic has influenced you and your work?
Well, Mary Jo, that's a really dangerous question because I'm tempted to start at the beginning of my life and extend the story for a blow-by-blow rendition of why I am here and what actually happened at the front end of the pandemic. But I, of course, will not do that, although the reason I'm tempted to do it is that as I reflect on my life and my current position, I realize that I actually draw on learnings and skills, attitudes, behaviors that date back to my childhood. So where I'm from, people might refer to me as a small town girl who made good in the big city. And I'll fast forward to my professional life and tell you that, tell the audience that I'm a neurologist by trade. I'm a physician, and over the past 25 years, I have had leadership roles in healthcare, either at the professional level or at the administrative level. And the impact of that evolution has been really profound for me. If I fast forward to the middle of March or early March, when we realized what we were going to be facing in the pandemic, I would say my mind first went to 2003, when I was involved in leadership position during SARS. and my assumption was that it was going to be quite similar. That we were going to be imposing certain conditions and behaviors, but I was sadly mistaken. And the reason that I say that is obvious from the point of view of the pandemic, but there were differences both in the virus and in me. So again, thinking back to 2003, SARS was a virus that was more lethal, but it was much less infective compared with COVID-19, which is probably less lethal, but very, very infective. In 2003, it was largely confined to the hospital. So people who were in the hospital understood what we had to do, but outside, other than the fact that we might have been looked at as being a little bit dangerous for spreading infection, life went on. You could go to the movies, you could go to restaurants, and it was fairly short-lived. So it would have been finished by several months ago in 2003. In contrast, we're looking at an event that has seemed very, very long, very confining, very tedious, and as we were recently talking about, there's a great deal of loneliness in the environment. But the difference in me is that in 2003, I was a fairly nascent leader. I had three roles. I was an active neurologist. I was seeing patients, including patients with SARS. I had a medical leadership position, and I had a administrative leadership position at one of the three hospitals that comprised University Health Network at that time. So those, if you having yourself been a hospital leader, know that those have competing priorities, and for me it was a balancing act to understand the greater good, to lift it was a challenge for me to lift myself up and think of the entire environment rather than my my own personal and professional needs and goals and objectives. And in a slightly different look on that is I had a strong belief that I had to prove myself in all three of those realms. So we got through that and come up to the year 2020, and I have a unified role. I have one role. I'm going to back up a little bit and mention that when I was recruited to CAMH, I will come up to my 11th anniversary in a few months, but when I was recruited, I had a very large job at the University Health Network, and on the surface of it, this seemed smaller. A smaller organization, a smaller budget than I was already dealing with, and the board chair, who was Paul Beeston of the Blue Jays, persuaded me that this was not just a running of the hospital job, that it was a job that would allow me to actually be part of a movement, part of the mental health movement, and to have the platform of CAMH to move the world of mental health forward. And that has certainly come to pass. We can maybe talk about that later if possible. But even though I had one role, that role had three parts during the pandemic. And the first one would be obvious to most people. It's the leadership role, the setting the tone for the organization, communicating in a way that is transparent and decisive to signal to people this is a bad problem we have, but to avoid becoming totally pessimistic about it, talking about the work that we have to do, making meaning of the work that we have to do, and supporting the organization through to a better future was a little easier at the beginning than it is now. So the leadership role, the management role, keeping staff safe so that they can care for patients, keeping patients safe, making sure that we have the resources to manage what we have to do in the moment and as we go forward. And last but not least, for CAMH, which has the unique position of having actually four mission pillars. Most of our hospitals would talk about patient care, research, education. CAMH from its inception had the mandate and the self-imposed mission to change the way society thinks in response to mental illness, to build a system and to promote and advance the importance of mental illness as being central to healthcare, not marginal, to being pivotal, not marginal. During this, we also understood that it was important. In a dangerous time, there's a tendency to close in on yourself. So to consciously open ourselves up to helping a community in a variety of ways, helping to drive policy that would support mental illness, and that was a hard thing at the very beginning, because if you can picture the focus in March, the concern was critical care. Was general hospitals, and it was important to me, at any rate, that we stood back and also had information that made it clear, even from the European and the Asian experience, that people with mental illness were at very high risk for infection for a number of reasons. They have other non-psychiatric medical illnesses. They have difficult living situations. They are often racialized. All things which increase risk. And like other chronic illnesses, it tends to slip away from consciousness when you're dealing with something that seems so frightening and so lethal in the moment. So we really had to push the boundaries of our thinking, and you and I talked about what happens at the intersection of the pandemic and the world of mental illness, and I would frame it as three important things. One, a sort of a lie was exposed, and number two, CAMH has changed, and number three, we're responding to a world that has changed. And the lie is that shared suffering brings people together, or a disaster or something terrible happening actually brings people together. What in fact it does is exposes the fractures. It exposes the differences in socioeconomic status and again, racial injustices. It plays out in many different ways. If we think about who had something as privileged as isolating ourselves, who actually had to come to work, who had a lack of access to digital technologies, etc. All of those things come into play, and I'm always reminded of reading a C.S. Lewis book. We all know C.S. Lewis for The Lion, the Witch, and the Wardrobe, etc. But he was also a fairly spiritual person, and I came across this about 15 years ago when I was facing a difficult personal situation, and this is about protecting the people that look up to you. And the quote, his mother had died and his father had pretty much fallen apart in response to it, and he says this line that people believe that shared suffering brings you together, but when there's a very significant difference in power or authority or ability between the two parties, a sign of weakness in the powerful person is actually paralyzing and alienating. So to me, it was really, really important to show strength to the organization and to the system, that we were going to be able to support people who were marginalized in the environment. So the lie exposed, the changes in CAMH. CAMH is a mental health organization, so you can imagine that there is a great deal of talk. CAMH is a passionate and a talkative organization. So we had to go from being a collaborative organization, talkative organization with lots of iterations in decision making, to overnight command and control. Right. So, the standing up of the opening up of our pandemic plan, the standing up of the command center, and those are all very, very alien things to CAMH, and we walked through them, walk through them one by one, and at the same time, we're aware of the fact that over the past probably 30, 40 years, but in the CAMH lifetime, which is only about 22 years, the discourse surrounding mental health has changed. So people are able to discuss mental illness, particularly depression, anxiety, and sometimes substance abuse, a little less complex mental illness, but people are also more willing to seek help. So we knew right up front that we would be faced with the potential for having to deliver more services in different ways. And we were able to very, very quickly, as part of this, as many organizations were, to go virtual, but to also understand that, go back to that thing of our system role. And I'm coming to the end. I'll say that we understood right away that the public response, the system response, would be to the terror of a potentially lethal illness. And you may remember at the beginning there were appeals by healthcare organizations and drives to acquire funding and equipment. And we knew that for an organization that is caring for individuals with chronic illnesses, that would fall to the bottom in a priority way. So we made a conscious decision to actually give to the community. So we in about 2-3 weeks, we set up a website for the general public that had everything from self-help activities to pathways to navigate to in-person care. And about 3 weeks later, we had one set up for healthcare professionals. The first website has had about 500,000 unique visits, hundreds of or thousands of downloads of the available documents, and the healthcare professional one we've helped navigate several hundred people to care. So we've tried to respond in a way that, as I said, is local, supporting the work that we're doing, but also in a system way, and at the same time trying to contribute and understand what we can, the impact of the pandemic, and learning from it to address the residual of the mental illness burden at the end of it.
Wow. Thank you for sharing a little insight into the world that you're leading through and the challenges that it's presenting. So much to talk about. Let's take a pause there and maybe turn to Kathy. And Kathy Hay, could you similarly share a little bit of insight into your world and your leadership and the impact COVID has had on Kids Help Phone?
Yeah, thank you for that. And I do want to quote Catherine Zahn: there is no health without mental health, and the game changing that's happened through CAMH and your leadership in Canada is extraordinary. So I was reflecting on today, thinking about uncertainty in leadership and mental health and Kids Help Phone. And I think what I reflect on to begin, and I will give a blow-by-blow on my journey, but first of all, I think it's fair to say that uncertainty is in fact certain in our journeys in life. I think that's a given. Granted, right now it is quite uncertain, more so than probably any of us know in our lifetimes. And the other thing that I was reflecting on about today, and all the students and faculty and alumni, is that leadership in uncertainty, leadership is built. It just doesn't show up. Today I will be a leader because we have a pandemic. I also think that the world changes all the time, and we're all quite adaptable to change. I don't really think that there are people that can't accept change. We change every single day, whether the weather, today it's raining, so we're changing for weather. But I do think in there, the journey that we all are on is steeped in resiliency, and it's steeped in courage and hope. I think that's part of who we are as people. So when you think of leadership in uncertain times, it's the skills you might have learned on your journey, the experiences you have, and it actually ends up as the values you take from your past to the work you do today. So hence, I'll now give you a little bit of a blow-by-blow on Kathy Hay. And I think most people could look back and go, well, my journey wasn't really linear. It wasn't from here to that destination, and nor should it be. So I started university at the University of Waterloo, and I quit at 20 years of age and got married and started this great life and got a job, not a career, a job as a bank teller. And then I went about learning, and I did just about every single job you could imagine in retail banking. And it's where I learned that leadership has nothing to do with the title that you have. It has everything to do with how you approach your day or your world. And so I felt I learned leadership as a teller in all of those jobs that I did. And I do want to say that if you approach your role, whatever it is in an organization as a leader, you will excel. You just will. I held the largest growing portfolio. I started at CIBC and ended up at Banque Nationale in retail and investment portfolio at the bank. Highest growing portfolio, least paid. It's a whole other discussion as a female banker way back when. And I had no degree. So, and I am not telling anybody, not one single University of Windsor student, to not finish your degree, because I ended up finishing my degree. But that was uncertain times. And then I picked up and moved to São Paulo, Brazil, where I got a complete change of career. Moved into the not-for-profit charitable space, I suppose, set up a Canadian foundation, a small group of us, and it changed everything for me. And I guess there's uncertainty enabling leadership and life-changing activities. So when I came back to Canada, it's the work I do today in the not-for-profit charitable sector. And I think I do want to say I also finished my degree in economics and psychology, did get a Canadian securities designation to trade securities. So education was tantamount to my success, but it was certainly not how I started out. So let me just bring my little bit of history in academia and healthcare to the role I am in now, which I actually think is probably the most important role I could ever have imagined assuming, because health requires mental health. And so I lead Kids Help Phone. It is the only 24/7 national bilingual e-mental health solution for young people in Canada for their mental health. And in 2019, all of 2019, we interacted with young people 1.9 million times in every province and territory in both our languages, with underserved remote people, young people, and into urban environments, obviously. So I think the message here about leadership and uncertainty and the work I do now is around nimbleness and being prepared, I suppose. When the pandemic hit, I want to remind everybody that this has not been a particularly great year across the globe. And because Kids Help Phone is a virtual environment, we do everything through technology. We are data driven, and we hear from young people as young as 5 through to about 26 every single day. And so what young people are feeling, experiencing, issues that they're having, we are experiencing in real time with the young people of Canada. So when 2020 began, it was very early in January where there was a terrorist attack that brought down an airplane where 63 Canadians died, 63 families, 63 communities impacted. We saw on all our platforms a huge spike at that period of time. And we're used to that. We're built for that. It wasn't very long after that that the news was all over the globe and in Canada around wildfires all over Australia. And I give this because it's important. And so the young people of Canada responded to that, seeing what they saw in media. Numbers went up again. Kobe Bryant's plane crash or helicopter crash, volumes increased as well. And underneath all of that was the, there's an epidemic. Sounds like a pandemic now, and then March hit. And as Catherine was saying, everything changed in this country. And organizations like CAMH and Kids Help Phone, we had to immediately change to meet the needs of those that we serve. So we enacted what we called our BCP, our Business Continuity Plan, with 3 very, very simple but critical things that enabled us to do what we needed to do. The first, they all seem obvious, but they're big. First was, how do we keep our people safe and how do we keep them whole? That was job one, and we had call centers across the country, 3 big ones in Montreal, Toronto, and Vancouver. How do we keep our people safe? And we have to do that because we have to keep our service 24/7, uninterrupted in both our languages in every single province and territory. So if you don't have one, you're not going to do the second. And then the third thing, we're a not-for-profit charity. How do we approach our financial strength and stability to be able to weather the storm, not knowing how big the storm was going to get and who knew it was going to be this long? That was March 15th, let's say. By March 25th, we were fully remote across the country, which we weren't designed to do. But it's funny what you can do when you roll up the sleeves, but you also look to your people and you see the leadership throughout the organization, and you know you're going through uncertain times. So setting the tone from the top for sure, and relying on your people to lead all the way through the organization. And then I would say Canada showed up. Not only did they need us, but they showed up financially. So we were able to weather the financial storm and still are. So fast forward to today, and I can tell you, remember that 1.9 million number. We are at Kids Help Phone. We stood up 3 new innovations through that, by the way. Innovation thrives in times of uncertainty because opportunity is there. So as leaders, to stand on the sidelines through pandemics or uncertainty means you'll miss it. So we stood up 3 services in the midst, and we are north of 3.5 million interactions right now with 3 months to go. And I guess my reflection on what might be important for people today is leadership is not a today I will be a leader. You're leading every single day, and change happens every day. Uncertainty is part of life. And I don't say it to discount it, but we are way more adaptable. We anchor against resiliency as people, and I think as Canadians, more so than most. And so stand in your values, stand in your resiliency, because there are silver linings all through what we've just gone through. So my pontification is ending right now, Mary Jo.
Thank you, Kathy. Thank you so much to take away and so many questions I'm sure to build on. So thank you both. Remember to the audience, the live questions are now open for you. We are incredibly fortunate to have access to these two remarkable experts today. So we'll take our first question from the pre-submitted by the audience, and I will await the online questions to come in. So our first question, the future is inherently unpredictable, and you talk about change, and change is an inherent part of life, but it can also provoke uncertainty and fear for some. Change can be crippling. So what can we do to embrace change and to build resilience? And maybe I'll turn to Catherine to start with that. So embracing change and building resilience, we need some tools. Give us some insight.
So Kathy actually spoke a lot about this, about how you can reframe this in your mind. It's a terrible thing that's happened, but on the other hand, I am also proud of the response of CAMH, of our province, of the nation of Canada, and proud of the citizens of Ontario and of Canada and how we've responded to this, and I think we also have to appreciate that getting through it, there's not going to be a hero. Right, this is going to be a togetherness piece, and the framing here is to appreciate that we're also part of something enormous, something that rarely will a population have the opportunity to live through and move through, and know that we'll get out the other end, but only en masse, only as a group. What I tell people as individual human beings and as groups is really on three levels. The way you get through is to take care of yourself first, to do healthy things, to continue to exercise, and to read and eat well and sleep. On the next level is you have to count on your personal resources, your family, your friends, the people that are around you. And I mean, speaking from someone who works in a caregiving organization, not everybody has this privilege to care for ill people, but we all have someone to care for. And this is a basic neuroscience phenomenon that people who care for others, caregivers, in whatever form, do better. It makes you feel good. So while you draw on the support of your friends and family and your coworkers, in giving, they will be better, and you giving back will also be healthy for you. And on the third level, some people are ill. So I worry seriously about the people in our care at CAMH, especially people with complex mental illnesses who are disconnected from their usual supports and care. And so I worry that they will become more ill. So it's important for us in the environment to be reaching out. There is a lot of anxiety related to the fear of the illness, the public health measures imposed, the economic downturn. So people are very anxious and upset. And this is a public service announcement. We just need to be careful to not necessarily interpret that as an illness. It's a normal response to a terrible situation. And having said that, there are some people who do get ill. So one of the reasons why we worked hard to put up public that people can call on. So if you are feeling that you're crossing the line of becoming hopeless, or feeling that you might harm yourself, it's important to reach out for help.
Terrific advice. Thank you for that. I'm going to keep, we'll maybe do one question each, so there's so many that are coming in. So this is about kids, video games and children. So we're going through a pandemic. We've got kids at home. Most of them now have school, but many of them don't. How long is it appropriate, since we are in COVID-19, and a lot of sports have been canceled? How long is it appropriate for kids to be on video games? And how can I support my children during these uncertain times? So Kathy, over to you.
Well, I would not suggest a specific time frame. I think we're all somewhat addicted to our gadgetry, though I do think there is a healthy limit on it. But I do want to say that the reality is that we are in a digital world, and for us to assume we're not, kids shouldn't be on screens, is probably steering you in a direction as parents that might be difficult for you to enforce. The reality is kids are going to be on their gadgets and on screen, and they'll learn through social media and whatnot. The worry we have at Kids Help Phone is not how much they're going to be. We do worry about too much screen time at Kids Help Phone with young people. I'm not saying that. It's how they're consuming it, what it is they're consuming online, and what it is doing to their well-being and their mental health. So a few examples from data, and parents should should know this. So it's good information for a parent. Since the pandemic began, pre-pandemic, kids have been dealing with cyberbullying. TELUS does great work against cyberbullying. It is an issue, a big issue. We deal with it every single day at Kids Help Phone. Pandemic hits, and cyberbullying stayed pretty flat. We saw a 69% increase in kids reaching out to us across the country about eating disorders and body image. And so we equate that in our clinical teams and love to work with some of the researchers at CAMH on this. What they're seeing on their screens is perfection. Everything looks great, everyone's happy, they're not interacting with people live. They're only seeing what they're seeing on screens and TV. And so we saw a huge increase in that. So my recommendation as a parent who survived the teen years, but also from what we do see with young people across the country, there is a bit of common sense in there. We do need, as Catherine says, healthy exercise and outdoor activities, family activities, cook together. And families aren't traditional like what we remember, but there is a limit to what kids will learn off of a screen, and there is damage to be done if they're just learning off a screen to their mental well-being.
Maybe, and I may add, it's important to introduce kids at a young age to other activities, and that's a hard thing to do when we're in a pandemic and we have lockdown and some of the barriers that have been put up for everyday activities. So it takes some work to have a plan to get beyond the just sit at a screen. Let's get outside and do something healthy.
A silver lining, though, quickly, is it's through that kind of screen that young people can learn help-seeking behavior. They can learn how to reach out. They can learn how to find tools. CAMH Kids Help Phone has enormous self-directed tools. They can learn how to actually get professional counseling through technology. So there are silver linings.
Absolutely.
Yeah.
Absolutely. So let's go to a live audience question. So I'm going to ask you, Catherine, in your opinion, what are the most important skills that leaders need to develop in order to adapt to times like this?
So I will start with a story that probably you've heard before. I was introduced to this concept by a retired professor of history at the University of Toronto at a dinner talking about leadership and recruitment. And he was grumbling and grouching. He says, I don't know why we talk about this anymore. There are only two things a leader needs, and one is robust, good health, and the second is thick skin. So aside from that, though, I think the important things to think about, or the things that I draw on, are first of all, something I would say is just self-knowledge. Okay, so understanding yourself, understanding your strengths and your weaknesses, your triggers, and self-knowledge is trusty partner self-control. So as a leader myself, I find it not too hard to be self-reflective, but the self-control part is one that we have to work on for the reasons that we've all talked about. What your role is, what the expectations are. The second one is communication skills, and I don't mean just public speaking. I mean listening, parsing what people say, synthesizing a response that has meaning and substance, and in situations like this, signaling. This is where I draw on some of my very ancient childhood knowledge, signaling that we have to be optimistic, not pessimistic, but we also have to know what's in our control and what's not in our control. So being a bit fatalistic and understanding where we need to focus our efforts in trying to control our environment. And the other piece of that is in these confusing times. It's also a rural metaphor. It's sometimes very hard to understand what the real issue is that you're dealing with. And so there's a thing that happens in rural communities is in the summer, sometimes you have to hose down the dust clouds. Right? You have to get rid of the noise and really understand, this is part of the communication thing, understand what it is that people are saying. The first thing isn't necessarily what the real worry is. And last but not least, and this is a thing that I would say people should work on developing, honing your sense of, or opening up yourself to new things, being curious, staying curious as a human being, and watching for ideas and opportunities, and that's what will make you creative as a leader. So those three things: self-knowledge, communication skills, and creativity.
Fabulous answer. And we, the basis of the series is really to engender conversations about leadership. And, there are books, hundreds and hundreds of them. I'm hoping that the audience is taking away from this how the words that Catherine just shared in terms of those skills is how she's practicing in her own life. And I can see that playing out in the stories that you shared with us. So back to our audience for the next question. We are seeing reports of a spike in suicide and depression in some countries. Are we seeing the same trends here in Canada? And what should instructors be on the lookout for students in their online courses? I'm going to turn that to you.
Yeah, it's a great question. And I may turn it over to Catherine after I finish because of the work that they do. So pre-COVID, and I think this is really important to remember, is mental health and the challenges that people have been experiencing from suicide, self-harm, anxiety, depression. We deal with all of that at Kids Help Phone. It did not get reset when COVID began. It all was full, robust crisis, I will say, in Canada pre-COVID. At Kids Help Phone, 20% of all the work we do is in suicide and suicide ideation. Every single day, we are involved with at least 15 active rescues every single day right now. So that's pre-COVID. Overlay everything that people are feeling, fear and anxiety and stress and loneliness, isolation, on top of what was before. And I would suggest that we need to be extremely diligent as citizens in Canada about each other. And suicide, and I will turn it over to Catherine in a minute because of the good work CAMH is doing. It is a crisis in this country. I will quote two statistics that stagger me to no end, that Canada has the highest youth suicide rate, the third highest suicide rate in the industrialized world. Canada does, in the industrialized world, third highest suicide rate. move into some communities that have almost no access, if any access, to support. And it is an absolute pandemic in its own right. And then the other thing to be mindful of is that it is the most significant cause of death for young people is suicide. So things to watch out for: difference in behavior, pulling away from normal activities, friends, family, and not to be fear-mongering. And I will stop, and Catherine, please jump in. But sometimes there's not that many signs for parents that they notice. And that is the scary thing about suicide. And that is why the work that CAMH is doing, the work that Kids Help Phone is doing, is important for our future.
So this is a question that I'm asked quite regularly, and it usually takes the form of, are you planning for the post-pandemic pandemic of mental illness?
Mm.
And my answer is similar to Kathy's, that the pandemic of mental illness predated the COVID-19 pandemic by decades, if not centuries. This is in our environment now, and I mean, we have statistics about, not specifically suicide yet, but certainly about mental illness. CAMH has been involved with a data company called Delvinia, and we have done 4 or 5 surveys now throughout the pandemic, and there's definitely been an increase in depression and anxiety, substance use. The most vulnerable groups are women, people with children, and young adults. The suicide issue, there's so much to say about this, but largely we're talking about the result of either an illness that causes psychosis or depression. It's a little bit different in an emergency like this, and I don't have specific data about this, but the important thing about Kathy's statistics for Canada is that we have to remember what the most vulnerable groups are Indigenous communities. For one, that we need to be figuring out ways to approach that problem, and it's multi-level, multi-generational, as everyone knows. We forget elderly men. That is the #1 group of suicides, and largely rural rather than urban. So I think we have to explore a little bit, if we're talking specifically about suicide, explore the risk stratification of the different groups, and then implement directed, focused interventions in these various areas. There is some data from other disasters, and there is this wave of increased anxiety that tends to dissipate, but people who are very vulnerable, people with mental illness, people that have the excess burdens of society that we've already talked about, we need to be focusing on the special populations at this point.
I agree. And when you think of racialized people as well, what we're seeing is people who contact Kids Help Phone, all ages. We have all ages as well. Those that experience racism, for example, are some of the most distressed texters who come through to Kids Help Phone, second only to those that fear imminent harm in their own homes, are those that experience racism. And if they speak about racism, they're also most likely to talk about suicide. So epidemic, pandemic, and it predates COVID by far.
And so the resources that you both spoke about in your own organizations, but there are many that are available across communities. We need to encourage access to. We need to support each other. We need to remember to be kind to each other. Yes. The things that make us human are called upon now more than ever. Let's do one last question from the audience. There's so many here to speak to. So you know, we've got an audience of mixed students and faculty and staff in our community and alumni. Most people are working virtually or working from home, from office, from wherever their space is. Sometimes that space is not ideal, as you've alluded to. Here's the question. Especially while we're eagerly waiting for the return to normal, how do we plan for the future without giving up on and compromising the opportunity we have in the present? It's a fairly profound question. And I think really relating to, let's start with the return to normal. I think we have a perspective on that we talked about last evening.
Yes, I'll give you another quote. This is from a song, and I've used this in the past. Probably most of the people in the audience are not old enough to remember Mad Max Thunderdome, but you'll remember the Tina Turner. We don't need another hero. And we don't need to know the way home. We're not going to go back to what we knew before for some considerable period of time. I spoke about the idea that we have to move through together, but the last line is we just need to find life beyond the Thunderdome. So we will walk through this, step by step and come out of it. I'm not even sure how else to say that is something that as a society, as humanity, as the world, we will go through it, and what we have to prepare for is something that's different, and it's not completely clear in my mind what that will be. There will be movement restrictions. The hospitals will look different. Our behaviors will be different. We'll interact with each other differently. My hope is that we come through it with a heightened sense of awareness of the environment, the global environment, a sense of compassion and love for our fellow human beings.
And do you want to add anything to the focus on how do we not compromise on our dreams, I guess, about tomorrow when we're dealing with and trying to manage our life through the crisis of today?
Yeah. I think I anchor back to what I've said before, and I'll say any day of the week, is we are highly resilient people. And this is a really tough time. There is no such thing as business as usual, and I don't actually think there ever has been. I think we always are moving forward. We're always looking forward. And I agree with Catherine and yourself. Who knows what next year is going to bring, but within there is strength in being vulnerable. There's strength in not being okay. There is strength in each other. I fully agree with you, Catherine. We have to do this together. Be kind. And I guess the final thing that I say is with courage does come resiliency, or resiliency comes courage. I think that's interchangeable. But when you stand in those places and in your values, hope is always there, and so I'm hopeful.
Great responses. So I can't believe this, but we are coming to the end of our special event. I want to extend our thanks on behalf of everyone at the University of Windsor to both of our guest speakers today, to Catherine Zahn and to Kathy Hay. Thank you for sharing your expertise, your wisdom, your insights, and your hearts with us. Your insight and leadership has really been a bright light for all of us as we journey through really unpredictable times and deal with our own issues through that. So is there one final word that you would like to leave with the audience this afternoon as we carry on into our day-to-day lives? And Kathy?
I would say take care of yourself, take care of those around you, and seek help, reach out.
Thank you for that.
Kids Help Phone is here.
Thank you for that.
I would say that talking about, it's not a silver lining, but it's another side of this coin here. All of humanity is part of something magnificent in the sense that it's huge and all-encompassing. And if we think about it in that way, I think there's some solace to be gained from understanding that we're all part of a global effort.
Really important, right? You think about yourself and something that's way
part
bigger
of something
than you.
big.
You're part of something really big. Fantastic, fantastic words. Thank you. I want to thank each of you for joining us today for this important dialogue. And just a reminder, if you find yourself in need of mental health support, we've listed a number of local resources on the screen, and we ask that you please reach out and seek the support that you need. And as we come to a close this afternoon, I ask you to take a moment to have a listen to a community message from TELUS. Thank you, TELUS, for your support of today's event, and thank you, each of you. Our video is going to run.
I've been watching, I've been wondering, we've been saving up, we've been growing now, and how